Gunshot wounds leave behind more than just scars. In many cases, they leave behind the bullet itself, lodged deep in muscle, bone, or even near vital organs. But here's the million-dollar question: should those bullets always be removed? You'd think the answer is a no-brainer. Of course we should take them out, right? Not so fast. Medical science has been exploring this very issue for decades, and the answer is a lot more complicated than it seems. In today's video, we're unpacking the science, risks, real-life case studies, and current medical opinions about retained bullets. Is it safer to remove them or to let them stay? The growing problem of gunshot wounds. Gun violence has become a major public health concern, especially in countries like the United States. In 2008, the US had the second highest rate of gun deaths in the world. And beyond the tragic loss of life, the cost to the healthcare system is staggering, over $70 billion annually. Young black males are disproportionately affected, and most gunshot injuries involve the extremities. While many cases involve soft tissue damage, others result in multiple organ trauma or embedded bullets that raise serious treatment dilemmas. That brings us to today's core discussion. If a bullet remains inside the body and isn't causing immediate danger, should doctors leave it alone? Why some bullets are left inside. Contrary to what many believe, leaving a bullet inside the body is often the safer option. Most modern bullets, especially those lodged in muscle or bone, are inert and don't cause harm. Because they're superheated when fired, they're often partially sterilized, which lowers the risk of infection. A 2021 study of 3,004 patients with retained bullet fragments showed that only 11% had complications like infection or pain. Surgery to remove bullets can be far riskier, especially if the bullet is near nerves, organs, or blood vessels. In some cases, like spinal or abdominal wounds, removal could cause more harm than good. And when it comes to bone healing, studies show bullets rarely interfere. A 2015 study found that only 3% of patients with bullets in fractured bones had issues with healing. So while it may seem counterintuitive, in most cases it's actually safer to leave the bullet in place. When bullets must be removed. Despite the general safety of retaining bullets in the body, there are clear situations where removal becomes absolutely necessary. For instance, if a bullet is located in the cerebrospinal fluid, CSF, inside a joint or near the eye, it must be extracted. Bullets in the spine or brain area, especially when surrounded by CSF, can pose long-term risks, such as infection or lead poisoning. One case even documented a patient developing lead toxicity 6 years after being shot. Similarly, bullets lodged in joints like the hip or knee can lead to severe pain, joint erosion, and impaired mobility. And when it comes to the eye, immediate removal is crucial to prevent permanent damage. Another critical situation is when a bullet fragment presses on a nerve. Nerve impingement can result in burning sensations, numbness, muscle weakness, and even conditions like Bell's palsy. If scans reveal that a fragment is compressing a nerve or nerve root, surgical removal is often necessary to avoid long-term neurological damage. Bullets inside blood vessels also present a serious risk. Although rare, a bullet can enter the circulatory system and migrate, potentially causing embolism, stroke, or aneurysm. One case reported a pseudoaneurysm in the thoracic aorta resulting from a retained bullet, highlighting the danger. These vascular scenarios are always considered surgical emergencies. Lastly, systemic toxicity from lead is another major concern. Over time, retained bullet fragments can release lead into the bloodstream, especially if multiple fragments are present. This can lead to symptoms like abdominal pain, joint aches, neurological issues, and even behavioral changes. In such cases, removing the bullet is essential to prevent further harm. The lead poisoning dilemma. One of the biggest long-term concerns with retained bullets is lead poisoning. While most bullets are inert, lead can slowly leach into the bloodstream, especially in moist, active body environments like joints or muscle compartments. The signs of lead toxicity are easy to miss: vague abdominal pain, fatigue, tingling limbs, and even depression. But over time, the condition can become serious, even fatal. That's why doctors often monitor blood lead levels in patients with retained bullets. If levels spike or symptoms appear, removal becomes urgent, even if the bullet has been in place for years without issue. So, should retained bullets always be removed? Not necessarily. In most cases, surgeons weigh the risks of removal against the likelihood of complications, and more often than not, it's safer to leave the bullet alone, unless it's in a dangerous location or causing active harm. Gunshot wounds are complex, and there's no one-size-fits-all answer. But thanks to ongoing research and long-term studies, doctors now have a clearer roadmap to make the best choice for each patient. Don't forget to like, share, and subscribe for more deep dive content on medical myths, trauma science, and health stories that matter. And if you've got a topic you'd like us to cover, drop it in the comments below. Thanks for watching, and remember, sometimes what stays inside tells a powerful story too.